did you learn about the new technologies available today, and how do you differentiate these technologies?
So I learned about shockwave therapy really when I went to train with Dr. Bano in Illinois. He's a urologist, and I want to make sure I train with a urologist, someone in my field, not just someone who had picked up some shockwave machine and just started using it. And that's really where I learned about shockwave therapy. And he had a Storz device, this machine right here, which is really one of the more original type of machines, which is what we call radial wave technology. And radial wave is just like if you were to drop a rock in a pond in the water, and we'd see those rings of waves go out. It's really a surface hit, and then the shock waves go out. So if I could borrow your hand for a second, Tim, and we can see here, yes, doesn't feel so good. And it's a very tight, narrow range that we're shocking at. So it is often rather uncomfortable for the patient. We always would give numbing cream for this. And often a number of those patients would even require a penile block, an injection, just to make the treatment comfortable. Even about the time when I started with this, I had met you at the Sexual Medicine Society meeting, and we talked about the UroGold machine and some of the merits of it, but I was very new into sexual health, and I don't think I really had the experience to make a decision. This machine was a little cheaper, and I said, let's just go with what I learned in my training and so on. And I've had an evolution over the past 3 years now, that in coming back around and talking to you and learning more of the merits and using this in a trial period, this is the UroGold machine. And it is basically a miniaturized version of what we use for kidney stones. There's a spark plug inside. It's electrohydraulic. It creates a shock wave. There's a little bit of water in here. It focuses, or doesn't necessarily focus, I think you'll get into that in a second, the shock waves onto the tissue. And you can also look comparatively at the size of the treatment head, much larger on the UroGold. So we're able to cover a lot more area. And the biggest benefit I find of this, not only do I not need a block on the patient with injection numbing medicine, I don't use topical medication anymore. So we're able to get to a treatment more quickly. It's more comfortable for the patient. And I think for our staff that is doing the shockwave therapy, that the patients are not in their hands very uncomfortable during the treatment.
So tell us a little bit about your experience so far with the UroGold. You're using it for what applications?
So we use it for erectile dysfunction, and we use it for Peyronie's disease, or the plaque, the scarring, the curvature, the pain with erections. And there are two types of probes that come with this machine. There's this unfocused probe, and there's a focused probe. And we'll use the focused probe to have a little more of narrowing of the field of shock wave to get directly at a plaque. It's also going to treat the ED as well. And the unfocused probe we're using when it's just a straight erectile dysfunction case. And we're having good success, and the patients are a heck of a lot happier. Certainly the ones that have been able to experience both machines of when I got the machine into the practice for my own use. And certainly from a comfort level, they're a lot happier.
So yeah, that's interesting. That thing that we offer with the UroGold is the two different applicators, and when you fire this, you can go ahead and fire it right in your hands. There's no discomfort at all.
The UroGold is a true acoustic wave technology, and actually the company is able to manipulate the curvature of the pressure wave itself, and it's not just the positive pressure wave, but rather the negative and positive pressure that can create a more significant influence on the cells and achieve a better success of what we're trying to do in terms of stimulating a response from the cells in healing and opening up those vessels.
A point to think about is that for the UroGold, for this technology, there's a positive and negative pressure. So what that actually does at a cellular level is it creates oscillation in the cells, and during that oscillation there's temporary permeability, so you have the release of growth factors, the release of healing agents, and essentially what it does is it sends a message. One of the healing agents actually is mRNA, and what that is a signaling protein that'll send a signal to your brain that there's a problem, and your brain will send in the troops with healing factors, and there's many of them. So it's a little bit more of an advanced wave. Have you thought about other areas that you could get into with the Urigold? Have you talked to your colleagues about some of the studies that are going on with other uses?
Well, I haven't quite gotten into it yet, but certainly I've tried it on myself and some of the people in my office as well. There have been a lot of orthopedic uses for shockwave therapy. I know it's out there for non-healing wounds, diabetic ulcers, and improving vascular flow really to any part of the body.
Those are all incredible markets that we're going to be hopefully making an impact in. With sexual health, we're excited that there might be some real benefits for women as well, but also conditions like prostatitis, which is very difficult to treat, usually treated medically, and patients are disappointed very often. So if there's some things that we can do to help your patients with that would be fantastic. I know Dr. Liu and Dr. Goldstein in San Diego, Dr. Liu in San Francisco are working on studies for female incontinence, stress-free incontinence. So there's a lot of excitement with that as well.
There's definitely a lot of exciting applications out there, I think, and I have tried this older device on women, and I can tell you the ability to numb a woman's vaginal and clitoral area to use this radial device is very difficult to do and almost intolerable on just about everyone I've tried, even though it's out there. And certainly I think with this newer Urigold device, I think it really opens up the applications in female sexual dysfunction. And prostatitis, we know, can be a very painful situation, and I don't think there's any man that would let me apply this to their perineum and treat their prostate in the amount of pain that would cause versus this new device.
So Dr. Chen, always a pleasure seeing you. Thanks so much for having us come today to your office, and we're excited to work with you in the future.
Thanks so much, Tim, and thank you for keeping in touch and opening my eyes further to this newer, better technology for my patients.